middle and the internal ear. Okay. So the external ear, which mainly consists of the auricle. So this is the auricle, also known as the pinna. And it also consists of the external acoustic meander. So the external ear mainly consists of two parts, that is the auricle, which is also known as pinna, and the external acoustic meander. So this part is the auricle and this is the external acoustic meander. So both these parts consist of the external ear. Now come to the auricle, which is also known as the pinna of the ear. So the auricle is a trumpet-like projection which projects from the side of the head. Okay, so this is the auricle or the pinna. Okay. Then the auricle has got two surfaces. So that is the lateral surface and the cranial surface. The one which you are seeing, so the irregular surface. So this is the lateral surface, and behind the lateral surface is the cranial surface. Okay. So this is the lateral surface of the auricle, and behind it is the cranial surface. Now coming to the lateral surface. So this is the lateral surface, which is irregular and it consists of many parts. Okay, now this is the helix. Okay, so the helix is the prominent and the outermost rim. Okay, so this part is known as the helix. Okay, so the outermost rim is the helix. Now if we trace the helix, so this is the helix. So if you trace it anteriorly, okay, so this is known as the anterior rim, or if you trace the helix anteriorly, it ends as the cross of the helix. So this is known as the cross of the helix. Okay, this is the cross, and the helix also consists of a tubercle here. So this is known as the Darwin's tubercle. Okay, so within the helix, you'll find a small projection which is known as the Darwin's tubercle. Okay, so is this clear? So the external ear mainly consists of two parts, that is the auricle or the pinna and the external acoustic meander. So now I'm talking about the lateral surface of the auricle. So the prominent outer rim is the helix, and which consists of a prominent projection which is known as the Darwin's tubercle. So this is the Darwin's tubercle. Now in front of the helix, okay, so in front and parallel to the helix, there is another rim, so which is known as the antihelix. Now, so this is the antihelix. Okay, so in front and parallel to the helix is the antihelix. Now, if you trace the antihelix superiorly, so this is the antihelix. So if you trace it superiorly, it divides into two limbs. So these are the two limbs or the two crura. Okay, so this is antihelix, divides into two limbs or the crura here, and here it includes is a space, the triangular space, which is known as the triangular fossa. Now this is the triangular fossa. Okay, so this is the helix, this is antihelix, and this is the triangular fossa. Now coming to another space here between the helix and the antihelix. So this is the helix here, and this is the antihelix. So between the helix and the antihelix, there is a space. Okay, so this is known as the scaphoid fossa. So this is the scaphoid fossa. The space between the helix and antihelix is the scaphoid fossa, and this is the triangular fossa. Okay, now coming to depression. The last depression here, okay, in the lateral surface here you find a large depression which is known as the concha of the auricle. Now this is known as the concha. Okay, the larger depression is the concha here, and in front of the concha there is a triangular flap of cartilage. This is concha, and here there is a triangular flap of cartilage which is known as the tragus. So this is known as the tragus of the ear. And just opposite the tragus, there is another flap of cartilage. It is also triangular in shape. So this is known as the antitragus. So concha, tragus, antitragus. And between the tragus and the antitragus, there is a notch. Okay, so between the tragus and antitragus, there is a notch which is known as intertragic notch. So this notch is known as the intertragic notch. Okay, so these are the different parts here. Now coming to another part which is known as the sigma concave. Now in this figure, so the last depression is the concha. So this is the concha here. Now there is another depression above the concha, or this is the cross of the helix. Just above the cross of the helix, you can find another depression which is smaller than the concha. So this is known as the sigma concave. Okay, so the concha and the simple concha, they are divided by the cross of the helix. Now this is the cross of the helix. So above the cross is the simple concha and below the cross is the concha. Okay, now this is the flap of fibrofatty tissue, which is known as the lobule of the ear. So this is the lobule. So lobule of the ear, it mainly consists of the fibrofatty tissue. Okay, so these are the different parts. So I repeat it again. So the ear has three parts: the external, middle, and the internal ear. And the external ear consists of the auricle or the pinna. So this is the auricle and the external acoustic meatus. So this is the external acoustic meatus, so which is also a part of the external ear. So don't think that only the exposed part is the external ear. Okay. So the external acoustic meatus. So this is also a part of the external ear. Okay. Now, auricle mainly consists of two surfaces, the lateral and the cranial surface. So the irregular one is the lateral surface. So the prominent outermost rim, so this is the helix. Okay, so if you trace the helix here superiorly or anteriorly, it ends here as a cross of the helix. So this is the cross of the helix here. Then in front and parallel to the helix, there is another prominent rim which is known as the antihelix. So this is the antihelix here. If you trace antihelix superiorly, it divides into two limbs of the crura. Here it encloses a triangular space which is known as the triangular fossa. So this is the triangular fossa. This is the cross of the helix. Now, between the helix and antihelix, there is another space which is known as the scaphoid fossa. Now, this is the scaphoid fossa here. Then there is a larger depression in the lateral surface. This is known as the concha. So this is the concha. In front of the concha, there is the triangular flap of cartilage, which is the tragus. Opposite the tragus or behind the concha, there is another flap of cartilage, which is known as antitragus. Between the tragus and antitragus, there is a intertragic notch. So this is the intertragic notch. And the lobule, so this is the lobule of the ear, which mainly consists of the fibrofatty tissue. And above the concha, there is another depression, okay, which is known as the cymba conchae. Or you can say the concha and the cymba concha are separated by the cross of the helix. So these are the different parts which you should know. Now, coming to the skin of the auricle, the skin of the auricle is very much tightly adhering to the cartilage. Okay, so especially in this surface, lateral surface, the skin is very much adherent to the underlying cartilage. Okay, and that's why whenever there is infection in the auricle, it is very much painful because the skin is tightly adherent to the underlying cartilage. Now, which type of cartilage you find here in the auricle? Anyone? Can you hear me? Am I audible or not? Okay, then which type of cartilage is present in the auricle? You see, it is the yellow elastic cartilage. So elastic type of cartilage is present in the auricle. Also the concha. So this concha is, it is rich in sebaceous glands. Okay, so in this part cancer, you'll find the number of sebaceous glands. That also should know. Now come to the another part of the external ear, that is the external acoustic meatus. Okay, so this is the external acoustic meatus. So this is also part of the external ear. Okay, so external acoustic meatus. So this part extends from the concha. Okay, so this is the extent. So it extends from concha to the tympanic membrane. So from the concha to the tympanic membrane. So this is the external acoustic meatus or the external auditory meatus. Okay. So external auditory or external acoustic meatus. So it conducts the sound waves from concha to the tympanic membrane. Okay. So the main function is it conducts the sound waves from the concha to the tympanic membrane. Okay. So this is the external acoustic meatus. Now the external acoustic meatus or the external auditory auditory meatus, it mainly consists of three parts. Okay, and it is divided into three parts according to the direction. Okay, so the shape of this external acoustic meatus is it is S shape. S shape. Okay, because the outermost is the pars externa. So the pars externa is directed upward, forward, and medially. It is like this. Okay, so upward, forward, and medially. Then the pars intermedia, the intermediate part is directed upward, backward, and medially. So upward, forward, medially, upward, backward, medially. The internal, the innermost part is directed downward, forward, and medially. So it is S-shaped. Or you can say sigmoid shape. Okay, S-shaped, sigmoid shape. So the pars externa is directed upward, forward, and medially. Intermedia is directed upward, backward, and medially, and the pars interna is directed downward, forward, and medially. So these are the three different parts of the external acoustic meatus, and this can be asked in cross spot. Okay, because we have a model of the ear, external ear, so we can mark here also, and we can mark, we can put chalk over here, so identify the chalked area on it. So the Sakinsa and mention is different parts, so you should write this. Or you can say it is the external acoustic meatus is divided into lateral 1/3 and the medial 2/3. Okay, so the lateral 1/3 is the cartilaginous part. Okay, so this part is made up of the cartilage, and the medial 2/3 part is the bony part. Okay, so the cartilaginous part it weighs around 8 millimeter, whereas the bony part it weighs around 16 millimeter. Okay, so 8 millimeter and 16 millimeter. Okay, now the cerebrous glands are mainly limited to the cartilaginous part and that secretes wax. Okay, so cerebrous glands are present in the cartilaginous part of the external acoustic meatus. The lateral 1/3 is cartilaginous, the bony part is the medial part. And what you should keep in mind is the bony part of the external acoustic meatus is not developed in newborn. Okay, so only the cartilaginous part will be present there. So not the bony part. Okay, and the bony part is mainly made up of the tympanic plate of bone. Okay, so this is the squamous part of the temporal bone. So that's why, as the bony part is not developed in newborn, so the external auditory meatus is very short in child. So you should be very careful, while examining the ear of a newborn or the fetus, not fetus, ear of the newborn with the help of the oral speculum, because the external auditory meatus is short, so there are chances of damaging or perforating the tympanic membrane. So this is the tympanic membrane here. So external auditory meatus is small or short in child because the bony part is not developed. So you should be very careful while examining the child or newborn with speculum. Now come to the constrictions. So there are mainly two constrictions here. So one constriction is at the junction of the bony and the cartilaginous part. That is at the junction of the lateral 1/3 and the medial 2/3. And one is at the isthmus in the bony part. So that isthmus is the constriction which is present in the bony part of the external acoustic meatus, and that lies around 2 centimeter deep to the concha. So here there are two constrictions present in the external acoustic meatus where there are chances of getting a lodgement of the foreign bodies. Now coming to the nerve supply. So till now you know the different parts of the auricle, the two surfaces of the auricle. So here you can see, so this irregular is the lateral surface and this is the cranial surface of the auricle. Okay. Now come to the nerve supply. Okay. So it is supplied by the great auricular nerve, the lesser occipital nerve, the auricular branch of the vagus nerve. Okay. Now the great auricular nerve. So here you can see this part. Okay. So most of the cranial surface. So this is the cranial surface. So most of the part of the cranial surface, as well as, so this is the lateral surface. So the posterior part of the lateral surface, which includes the helix as well as the antihelix. Okay. So most of the part of the cranial surface here and the posterior part of the lateral surface, which includes the helix, antihelix, as well as the lobule here. So these parts are supplied by the great auricular nerve. Okay, so this is supplied by the great auricular nerve. Now come to the lesser occipital nerve. Now this part, okay, so that is the upper part of the cranial surface. So the upper part of the cranial surface. So this part is supplied by the lesser occipital nerve. Okay, so this is supplied by greater auricular nerve, and this part is supplied by the lesser occipital nerve. That is the upper part of the cranial surface. Now come to the anterior part. Okay, so this part is supplied by greater auricular. Now this part, the anterior part of the lateral surface, is the tragus as well as the cross of the headache. So this is the tragus here and the part of the cross here. So the anterior part of the lateral surface, this is supplied by the auriculotemporal nerve. Okay, so this is supplied by auriculotemporal nerve. Now the green color part, that is the region of the concha. Okay, so the concha is supplied by the auricular branch of the vagus nerve, and this is important. Can be asked in cross spot as well as the MCQ question. Okay, so the part of the concha is supplied by the nerve. So the concha is supplied by the auricular branch of the vagus nerve. So great auricular nerve here, so auricular temporal nerve here, auricular branch of the vagus nerve here, and lesser occipital nerve. They are also same. Now come to the arterial supply. Okay, what are the arteries which supply the auricle? Now the anterior part of the lateral surface. Now this is the anterior part of the lateral surface, isn't it? So the anterior part of the lateral surface, so this is supplied by the anterior auricular branch of the superficial temporal artery. Now this is the superficial temporal artery here. So this is the anterior auricular branch. Okay. So superficial temporal artery, so these are the anterior auricular branch. So anterior auricular branch of the superficial temporal artery, so it supplies the anterior part of the lateral surface. Okay. Now come to the posterior auricular branch. So the posterior auricular branch of the external carotid artery. So this part, the posterior part of the lateral surface, is supplied by the posterior auricular branch of the external carotid artery, and it also supplies the cranial surface. Okay. So here, so anterior part of the lateral surface is supplied by the anterior auricular branch of superficial temporal artery, and the posterior, this posterior part of the lateral surface as well as the cranial surface is supplied by the posterior auricular branch of the external carotid artery. Okay, so this completes the part that is the external ear. Okay. Now come to the middle ear. So in the external ear, what you should know is the surface is the auricle, different parts. Then you should know the different parts, the concha, the tragus, and the lobule where usually pierce the ear. And so this part is usually pierced. So this is the lobule which contains the fat and the fibrofattic. So rest of the part where you find the elastic cartilage. Okay, so this and the nerve supply and the artery supply. Now coming to the middle ear. So middle ear or the middle ear cavity is also known as the tympanic cavity. Okay. So this is the middle ear cavity. So this is the cavity here, the tympanic cavity or the middle ear cavity. So this cavity or the middle ear cavity is present within the petrous part of the temporal bone. Okay, so middle ear lies within the petrous part of the temporal bone here, and middle ear cavity is filled with air. Okay, so it is filled with air and they are lined by the mucous membrane. Okay, so filled with air and they are lined by mucous membrane, and it assumes full adult size at birth. Okay, so at birth only it is of the adult size. And here you can see this is the cavity here. So it communicates in front here with the nasopharynx. So this is the auditory tube or the eustachian tube. So why the eustachian tube here or the auditory tube? The middle ear cavity communicates with the nasopharynx here. And behind here it communicates with the mastoid antrum. Okay, so posterior to middle ear cavity lies the mastoid antrum. So here in front it communicates with the nasopharynx. So this is the middle ear cavity, also known as the tympanic cavity. Now come to the boundaries. So it's important. Okay, it can be asked in SAQ as well as in the MCQ. So come to the boundaries of the middle ear. So this is the middle ear cavity here. So it consists of the roof. Okay, so this is the roof, and the roof is formed by the tegmen tympani. Okay, so this is formed by the tegmen tympani bone, and here the roof is pierced by the greater and the lesser petrosal nerve. Okay, so the roof is pierced by the greater petrosal nerve as well as the lesser petrosal nerve. So this is the, because in all the walls of the middle ear cavity, you will find the nerves. Okay, then the roof will find the greater petrosal nerve as well as a lesser petrosal nerve. Now this is the floor. Okay, so this is the floor, and in the floor of the medullary cavity you will find a jugular fossa which lodges the internal jugular vein. So this is the internal jugular vein which is present in the floor. Okay, and this part of this floor is pierced by the tympanic branch of the glossopharyngeal nerve. So the roof also you'll find the nerve, and in the floor also you'll find the nerve. Okay, so that is the tympanic branch of the glossopharyngeal nerve. Come to the anterior wall. So this is the medullary cavity here, roof. So this is the roof, technically tympanic. This is the floor. So this is the internal tubular vein. Okay. Now this is the anterior wall. Okay. So this is the anterior wall. Now in the anterior wall of the medullary cavity, so you can see there are three canals here. So in the upper part there are two canals. So this is one upper one. This is the lower. So there are two canals in the upper part, and this is the lower part. Okay. So in the upper part of the anterior wall of the medullary cavity, so here you will find a tensor tympani muscle. So this is the tensor tympani muscle, and in the lower part, the another canal lodges the auditory tube. Okay, so this is the pharyngotympanic tube or the auditory tube. So this is the upper one is the tensor tympani muscle, and this is in the lower part you will find the auditory tube. Okay, so in the lower part of the anterior wall there is a bony carotid canal which lodges the internal carotid artery. Okay, so this is the internal carotid artery which is present in the lower part of the anterior wall of the medullary cavity. To the posterior wall here, this is roof. So this is roof. This is the floor. So this is the anterior wall here, and this is the posterior wall. Okay. Now in the posterior wall, so this is the posterior wall. So here you have an opening, okay, so which is known as the adductus to the mastoid antrum, okay, because just that the middle ear cavity, okay, so posterior to the middle ear here, the middle ear cavity posterior it communicates with the mastoid antrum. So this is the adductus to the mastoid antrum, okay, adductus to mastoid antrum, because posteriorly there is a mastoid antrum, okay, and here in the posterior wall. Here you find the facial canal which lodges the facial nerve. So this is the posterior wall which contains the facial canal, and this is the facial nerve within the canal. Okay, so this is the posterior wall. Now come to the medial wall. Now this is the medial wall. Okay, so roof, floor. So this is the anterior wall. So this is the posterior wall, and this is the medial wall. Now in the medial wall of the medullary cavity, you find a bulged part, bulged area, so which is known as the promontory. Okay, so this bulged part, the bulged area is known as the promontory. So this is the promontory. It is a rounded elevation. Okay, so the promontory is a rounded elevation which is formed by the basal turn of the cochlea. Okay, the cochlea is the part of the internal ear, which is turned here. So this promontory, okay, so it is formed by the basal turn of the cochlea. So the cochlea is a part of the internal ear. Okay. Now within the middle wall, you'll also find the oblique part of the facial nerve. So here, this is the facial canal here. Now this is the oblique part of the facial nerve. Okay. And here you can see, you can also find the two openings here. Okay. So the upper one, which is oval in shape. So this is known as the fenestra vestibuli. So the opening which lies above and behind the promontory, this is known as fenestra vestibuli, and below and behind you find another opening. So the upper one is oval in shape, whereas the lower opening is rounded in shape. So the rounded one, this is known as fenestra cochlea. Okay, so fenestra vestibuli, fenestra cochlea. So these are the structure you find it in the medial wall of the middle ear. Okay, so all these are important, because all this can be asked in SAQ. Now coming to the lateral wall of the medullary cavity. Now which is the lateral wall here? See, this is the medullary cavity here. So this is known as the cochlea. So the cochlea, when it takes a turn, okay, when it takes a turn, the basal end of the cochlea will solve. So that produces the promontory, the medial wall. Now this is the lateral wall here. Okay, so this is the lateral wall. This is the tympanic membrane. So the medial surface of the tympanic membrane. So this part, the medial surface of the tympanic membrane, okay, so that forms the lateral wall of the middle ear cavity. So this is the lateral wall, this is the medial wall here. Okay, So the medial surface of the tympanic membrane. So the medial surface of the tympanic membrane forms the lateral wall. Okay, so these are the different boundaries of the medial air cavity. So you should know within which bone it lies. So it lies within the petrous part of the temporal bone, filled with air, lined by mucous membrane. It assumes full adult size and birth, and you should know its communication. So in front it communicates with the nasopharynx, behind it communicates with the mastoid antrum. The boundaries, the roof, the floor, the lateral wall, the medial wall, and the anterior wall and the posterior wall you should know. And in all the walls you find the nerves, isn't it? See, here greater lesser petrosal, the tympanic branch. Here in the medial wall also you'll find the oblique part of the facial nerve. In the posterior wall also you'll find the facial nerve here, isn't it? So in the anterior wall, you'll find the sympathetic plexus around the internal carotid artery. So in all the walls, you'll find the nerves. Now come to the tympanic membrane, which is also known as eardrum. So this is how the tympanic membrane looks. It is oval in shape, it is semi-transparent, it is pearly gray in color, and it is a trilaminar membrane. Okay, so it is made up of 3 layers, a trilaminar membrane. So this is how the tympanic membrane is placed. Okay, so this is auricle, external acoustic meatus. This is the tympanic membrane here. So this is the middle ear cavity, and this is the internal ear. Okay, so this is the external. Till here is the external ear. So the tympanic membrane, it separates the external ear from the middle ear. Okay, so this is the tympanic membrane, separates the external ear from the middle ear, and this is the internal ear. Okay, so this is the tympanic membrane, oval in shape, and it is placed obliquely. See, it is placed obliquely. In case of children, child cancer, it is placed horizontally. Okay, but in case of adult cancer, it is placed obliquely. Okay, so the tympanic membrane is placed obliquely like this, and this is how it looks: oval, pearly gray, trilaminar membrane. Now the tympanic membrane, it consists of 2 surfaces, the lateral surface. So this is the lateral surface and this is the medial surface. Okay. So the lateral surface is concave. So here you can see the concavity. So this is the lateral surface which is concave and it is directed towards the external auditory meatus. So this is the external auditory or the external acoustic meatus. So the lateral surface is directed towards the external acoustic meatus. And this is the medial surface. So the medial surface is convex and it is directed towards the middle ear cavity. Okay. So lateral surface. So this is the lateral surface, concave. So the convex one is the medial surface. Now here in the medial surface, here you find a maximum convexity. So there is a point where the tympanic membrane is convex at its maximum. So here, so that maximum convexity is known as umbo. Okay. So this umbo, U-M-B-O, umbo. So what is umbo? It is the maximum convexity which is present on the medial surface of the tympanic membrane. And in this part, you'll find the attachment of the handle of the malleus. Okay, so in this part, you'll find the attachment of the handle of the malleus here. And this is crossed medially by the chordae tympani nerve. Okay, so here it is crossed by the chordae tympani nerve. So this is important. Okay, so the tympanic membrane is crossed by which nerve? That is the chordae tympani nerve, which in turn is the branch of the facial nerve. So this also you should know. Now come to the parts of the tympanic membrane. So here you can see, so this is the handle of the malleus. Okay, so this is the tympanic membrane. This is the handle of the malleus here. So here is the lateral process. So this rounded part is the lateral process of the malleus. And here on either side of the lateral process, it gives attachment to the malleolar ligament. So this is the anterior malleolar ligament or anterior malleolar fold. And this is the posterior malleolar fold. So these are known as the malleolar fold because this is the malleus, this is the handle, and this is the lateral process of the malleus. So this is how it is, the handle of the malleus is attached to the tympanic membrane that is on the medial surface. Now, this part, okay, the part of the tympanic membrane which lies above the malleolar fold, so this small part, small triangular part, this is known as the pars flaccida. Okay, so this is the pars flaccida, which is a small triangular area which lies above the malleolar fold. Now this is the malleolar fold, anterior, and this is the posterior malleolar fold. They are attached to the lateral surface here. Now the rest of the remaining part of the tympanic membrane, you can say. The remaining part of the tympanic membrane, and so this part is known as the pars tensa. Okay. Now pars flaccida, so this part is loose. Okay, whereas the pars tensa is very much tensed. Okay, so it is made taut or tensed by the attachment of the handle of the malleus. Okay, so what are the different parts here? So the tympanic membrane. So the upper one, the small part, is the pars flaccida, whereas the lower part, so this is known as the pars tensa. So pars flaccida, so this is pars tensa, and it is made tensed by the attachment of the handle of the malleus. So this is the handle of the malleus here. Now another part is development. I think it will be dealt in tympanic development of the ear, but still this is very important. The development of the tympanic membrane. It is important in MCQ as well as in sport, so I don't want to miss it. So the tympanic membrane consists of 3 layers. The outermost is the cuticular layer. Okay, so the outermost cuticular, intermediate is the fibrous layer, and innermost is the mucous layer. So the outermost cuticular layer develops from ectoderm. And intermediate fibrous layer. Intermediate fibrous layer develops from the mesoderm. So outermost cuticular layer is the ectoderm, right? So the intermediate fibrous layer is the mesoderm, and innermost mucous layer. The outer cuticular layer develops from ectoderm, intermediate layer develops from mesoderm, and the innermost layer develops from endoderm. Okay, so it's developed from all the 3 germinal layers. So this is important. Now coming to the contents of what does it contain? What does the middle ear cavity contain? Okay, so it mainly contains the ossicles. Oh, so there are 3 ear ossicles. So they are so this is the malleus, this is the incus, and this is the stapes. Okay, so what are the main contents of the middle ear cavity? So they are the ear ossicles. So malleus, incus, and the stapes, and it also consists of 2 muscles. So they are the tensor tympani muscles here. So tensor tympani muscles. This is tensor tympani. This is the stapedius muscle, and it also consists of number of arteries. And I think there are 6 arteries, and it also consists of the nerves. Okay, so they are the main contents of the middle ear cavity. Okay, let's start with ossicles. So this is the malleus. So the malleus has a head. So you should be able to identify the 3 ear ossicles. So the malleus has a head. So this is the head of the malleus here. Okay. Then within the head here, you can see a cavity which articulates with the incus. The constricted part is always the neck, and there is a handle of the malleus. The constricted part is the neck. Then it also consists of handle as well as the 2 processes. So this is the lateral process. So this is the anterior process. So this is the anterior process. This is the lateral process, and this is the handle of the malleus. Next is the incus. So this is the incus. Incus resembles a premolar tooth. Okay, so it resembles the premolar tooth. So it consists of a body. So this is the body of the incus. The 2 limbs. So this is the short limb, and this is the long limb or the long process. We can say limb or the process. So this is the body, long limb, and this is the short limb of the incus. Resembles the premolar tooth. And this is the steps. It resembles a stirrup, that's what is known as steps. So it also has the head. This is the head. Then again, the constricted part is the neck, the 2 limbs. So this is the anterior limb, and this is the posterior limb, and this is the base. Okay, so this is the base of the steps. It is also known as foot plate. So foot plate or the base. Foot plate or the base. So this is the head, and these 2 are the limbs of the steps. So these are the 3 main ear ossicles. Okay. So as we have ear model, so you should be able to identify the malleus, incus, the one which has a rounded head and the 2 limbs. So this is malleus, and the handle of the malleus. So this is the one handle which is attached to the tympanic membrane. The one which resembles the premolar tooth is the incus, and the one which resembles stirrup. So this is the stapes. The muscles, the tensor tympani muscle. So this is the tensor tympani muscle. Okay, so this is the tympanic membrane. You can see here how the handle is attached here to the tympanic membrane on its medial surface. So this is the tensor tympani. It takes origin from the cartilaginous part of the auditory tube. Now this is the auditory tube here. So it takes origin from the cartilaginous part of the auditory tube and is inserted to the handle of the malleus. So this is the handle of the malleus here. So here it is inserted to the handle of the malleus. Okay. So the action is it draws the handle of malleus medially. Okay. So this is the origin. Here it is inserted. Come to the stapedius. So this is the stapedius. So it takes origin from the posterior wall of the tympanic cavity. So I think you must be knowing the stapedius is the smallest muscle of the body, taking origin from the posterior wall of the tympanic cavity here, and it is inserted to the neck of the stapes. So here, this is the stapes here. So here it is inserted to the neck of the stapes muscle. So it draws the stapes laterally. Okay. So this is the stapedius muscle. This is the stapes. So this is tensor tympani. So these are the two muscles which are present in the middle ear cavity. Okay. So in this class, so what you should know is that the ear has three parts. Then the external ear, that is, which consists of the auricle and the external acoustic meatus. So you should know the different parts of the auricle, the type of cartilage which is present in the auricle, and the nerve supply of the concha as well as the other parts. Then the length of the external acoustic meatus, okay, the 16 and the 8, the lateral part and the medial part. And which is cartilaginous part? The lateral part is cartilaginous, whereas the medial two-third is the bony part, that you should know. Then according to the direction, so it is divided into the parts externa, parts intermedia, and the parts interna. So this you should know. Then you should know about the tympanic membrane, how it is placed, how it consists of the three layers, and how it develops from all the three germinal layers, and the concave surface as well as the convex surface, and how the handle of the malleus is attached to the medial surface. And here it is crossed by the chorda tympani nerve. So that is also important. Next, come to the middle ear cavity. The middle ear cavity, which mainly consists of the three ear ossicles. It consists of a number of arteries and the nerves, which are present in all the walls as well as the floor and the roof. And the two muscles, so they are the tensor tympani muscle and the stapedius muscle. Then the different parts of the tympanic membrane, that is the upper one, the loosely arranged part is the pars flaccida. The tight dense part is the pars densa. Okay, so these are the manular fold. So this you should know. Now coming to the applied aspects. Okay, the clinical importance of the applied aspects here. So you must have undergone examination of the external ear, or you must have seen, okay, how the external ear or the external acoustic meatus or the tympanic membrane is examined. So whenever you have to examine the ear, you have to pull the auricle upward, backward, and laterally. So why? See, if you want to visualize the external acoustic meatus as well as the tympanic membrane, you cannot visualize it with your naked eye. You have to use an instrument, so which is known as the oral speculum, or also known as the ear speculum. So with the help of speculum, when you are going to examine the external acoustic meatus in the tympanic membrane, you have to pull the auricle like this. So upward, backward, and laterally. Why? Because the external acoustic meatus is not straight, isn't it? It is directed. It is S-shaped curve or sigmoid-shaped curve or the S-shaped curve. So to make the external acoustic meatus straight, you have to pull the auricle upward, backward, and laterally. Okay, so this you should know. So whenever you go for the oral speculum examination, the ENT specialist will pull your auricle like this, upward, backward, and laterally, and you should know the direction also. Then in children, in case of newborn, as the bony part is not developed, the external auditory meatus is short, isn't it? So that's why whenever you have to examine the ear with the help of oral speculum, then you should be very careful because it is short or small in case of children. So deep insertion of the ear speculum might damage the tympanic membrane, so you should be extra cautious. Then as the skin of the external meatus as well as the auricle is tightly adherent to the underlying cartilage. So whenever there is any infection of the external meatus, if most of you have experienced any infection, any boil, you get it in the external acoustic meatus of the auricle, it is very painful because the skin is tightly adherent to the underlying structures. Then sometimes if you get pain in the ear, that may not be from the pathology of the ear, but maybe referred pain from other side. Okay, so whenever there is caries tooth, you may get pain in the ear because of the distribution of the mandibular nerve. Okay, so you may get referred for pain in the ear. So whenever you have pain in the ear, there may not be pathology or infection in the ear itself. You may get the pain from the caries tooth as well. Now, earwax, the ceruminous glands, isn't it? The ceruminous glands are present in the concha or in the lateral part of the external acoustic meatus, which secrete the ear wax. Okay, so whenever there is presence of the wax, what happens? It blocks the meatus, so it impedes, it blocks the transmission of the sound waves. Then other advantage is it prevents entry of the insects, so the ear wax is secreted by the ceruminous glands. And it also helps to maintain a warm and humid environment for the vibrations of the tympanic membrane. Now, as I said, there are two constrictions in the external auditory meatus. So, one at the junction of bony and the cartilaginous part, and other at the isthmus, which is 2 cm deep to the concha. So, at the constricted part, as this two constricted part, so there are chances of getting loss of the foreign body. Okay. Next is sometimes whenever there is air wax and impacted in the external acoustic meatus. So what happens? You may have to do a procedure to take out the wax, which is known as the syringing. So you have to use one instrument to do the procedure. So that procedure is known as syringing. So whenever you do it, you have to, instead of cold water, you have to use a lukewarm water. Okay, because so whenever you use cold water, what happens? That may irritate the auricular branch of the vagus nerve. Now, the auricular branch of the vagus nerve supplies which part of auricle? Anyone? Auricular branch of vagus nerve supplies which part of auricle? Concha. Concha. Okay. I think most of you are sleeping. Oh? Positive demo I'll ask you all these. So the concha is supplied by the auricular branch of the vagus nerve. So whenever you do this syringing to take out the impacted wax, you have to use lukewarm water because the cold water that may irritate the auricular branch of the vagus nerve, and in case of elderly patients, the cardiac arrest may occur. Okay, so the cardiac arrest may occur in elderly patients. Now, otitis media. So what is otitis media? Infection and inflammation of the middle ear is otitis media, which is common in children. Okay, so the otitis media is very common in children because the spread of infection can be from the nasopharynx. I keep an eye the middle ear cavity communicates in front with the nasopharynx, okay, via the auditory tube. So the spread of infection from the nasopharynx is very common. So, and otitis media is very common in children because they communicate the running nose. So whenever they get running nose, there are chances of spreading the infection from the nose to the ear. So that's why otitis media is common in children. Now, what is myringotomy? So this is how the tympanic membrane is visualized. Oh, so whenever you visualize it with oral speculum, this is how it looks. So what is myringotomy? So whenever you have to do or whenever you have to give any incision in the tympanic membrane, so that procedure is known as myringotomy. And whenever you do that procedure, it should be done in the posterior inferior quadrant. Okay, it should be done in posterior inferior quadrant. Why? To avoid injury to the chordae tympani nerve as well as to the ear ossicles. Okay, so it is safer to do it in the posterior inferior quadrant. So you can mark it as MCQ question, which is the safer side for the myringotomy. This is the posterior inferior quadrant. see. Now, whenever you visualize the tympanic membrane with oral speculum, this is how it looks. Okay, so this is the handle of the Malleus here, and so whenever you use the oral speculum, so there will be light. So there will be light, and you will find a reflection of light here. So which is known as the cone of the light. Okay, and this is normal. Okay, so whenever you visualize the tympanic membrane, you will find a cone of light, that is the reflection of the light here, and it is always present in the 5 o'clock position. Okay, so this is known as the cone of light. And also, as it is present here, is present within the petrous part of the temporal bone. So CT as well as the MRI of the ear can be done. Okay, so CT as well as the MRI of the ear can be done. So I think this completes our today's class, that is external and middle ear. And in the next class, I'll be continuing